understand. 2, 3. If I sugar you all give me in my bug juice. No give me none of that.
What am I saying?
And if I sugar you all give me in my box drink. No give me none of that.
Hear me now.
Sugar can give you diabetes.
You can get very sick.
For real.
You can be hospitalized.
Don't look at me as if you're surprised.
Read the label and you might understand.
Start out yourself.
Get one.
Eat right.
Drink right. Exercise.
Read the label and you might understand. 2, 3. If I sugar you all give me in my bug juice. No give me none of that.
What am I saying?
And if I sugar you all give me in my box drink. No give me none of that.
Hear me now.
Sugar can give you diabetes.
You can get very sick.
For real.
You can be hospitalized.
Don't look at me as if you're surprised.
Read the label and you might understand.
Start out yourself.
Get one.
Eat right.
Drink right. Exercise.
Read the label and you might understand. 2, 3. If I sugar you all give me in my bug juice. No give me none of that.
What am I saying?
And if I sugar you all give me in my box drink. No give me none of that.
Hear me now.
Sugar can give you diabetes.
You can get very sick.
For real.
You can be hospitalized.
Don't look at me as if you're surprised.
Read the label and you might understand.
Start out yourself.
Get one.
Eat right.
Drink right. Exercise.
Read the label and you might understand.
Hello, everyone. My name is Dr. Kwesi Marshall. I'm the chairman of the National Food Industry Task Force, and it is my distinct pleasure to welcome you this morning to this launch of the Phase 3 Protect Our Children's Health mass media campaign from the Heart Foundation of Jamaica. We have a particularly interesting program of activities this morning, so I'm not going to say much right now. I'm going to, though, ask us to bow our heads as the opening prayer is delivered by Mrs. Shelley A. Gordon-Carruthers. Mrs. Gordon-Carruthers.
Good morning, everyone. Let us pray. Almighty, most holy God, we thank you for the gift of today. Thank you, Lord, for your grace and mercy towards us. Lord, we ask that you be with the organizers or partners and all participants here today. We place the proceedings in your hands and ask that you take care of all technicalities. Lord, please allow everything to run efficiently. In Jesus' name, amen.
Thank you very much, Mrs. Gordon-Carruthers, beautifully rendered. Okay, let's now start the proceedings in earnest. So we got 3 participants who are going to be giving their introductions back to back to back. Firstly, we're going to start with Mrs. Deborah Chen, who's the Executive Director of the Heart Foundation of Jamaica. She will then be followed by Mr. Ian Stein, who is the Pan American Health Organization, World Health Organization representative for Jamaica, Bermuda, and the Cayman Islands. And then greetings will be followed by Dr. Brian James, who will provide his own greetings, and he is the president of the Medical Association of Jamaica. So, Mrs. Chen.
An unhealthy food environment where food labels are lacking and difficult to understand has contributed to an epidemic of overweight, obesity, and non-communicable diseases in Jamaica, resulting in considerable death and disability, especially now with the COVID-19 and the heavy economic burden. We agree with recent statements in the press that we must declare NCDs as an emergency. We have to halt and reverse this trend. Consumers are at a considerable disadvantage without the tools needed to make informed choices about the foods they purchase for themselves and their families. A 2018 study conducted in Jamaica showed that 91% of respondents agree that there should be clear warning labels on the front of food and beverage packages to inform consumers when products are high in sugar, salt, or fats. In studies conducted in Chile, Uruguay, and most importantly Jamaica, simple high-in front-of-package octagonal warning labels that identify unhealthy products have been shown to be most effective in discouraging unhealthy food choices. In the local study, these warning labels on foods high in fat, sodium, and sugar were found to be 9 times more effective at identifying unhealthy foods than other label options. Ultra-processed foods high in sodium, fats, and sugar increase the risk of hypertension, obesity, type 2 diabetes, heart disease, and some types of cancer. It is for these reasons that the Heart Foundation of Jamaica, along with its partners, advocate for the implementation of high-in black octagonal front-of-package warning labels. We have not been daunted by the delays and other tactics designed to stave off effective public health measures. We continue to advocate for the rights of consumers to information and good health. We have a right to know what's in our food. As we strive to recover from the health and economic impact of COVID-19, a healthy population must be prioritized and health must be included in all policies. Investing in NCD prevention makes good economic sense, curtailing losses in healthcare costs and labor productivity and contributing to economic growth. A healthy population can support business and economic growth more than a sick population can. We must seek to ensure that our policies are effective and evidence-based, such as the octagonal warning label, and that the policy-making process is protected and free of conflicts of interest, undue influences, and interference. We look forward to living in a society which is more conducive to leading a healthy lifestyle. Protect our children's health. Give us octagonal warning labels on packaged foods.
Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Ms. Mariko Kagashima, UNICEF Representative to Jamaica, Mrs. Deborah Chen, Executive Director of the Heart Foundation of Jamaica, Dr. Brian James, President of the Medical Association of Jamaica, Dr. Kwesi Marshall, Chair of the National Food Industry Task Force and this morning's hosts, colleagues from the Heart Foundation of Jamaica and the wider health fraternity, ladies and gentlemen, good morning. Like many other countries in the region of the Americas, Jamaica has shown an increasing prevalence of obesity as well as non-communicable diseases over the past few decades. Unfortunately, the data reveals that NCDs cause 78% of deaths annually in this country. This is a startling piece of data which we all recognize and use as a fundamental reason why our collective efforts to address NCDs is so critical. It is notable that also, unfortunately, children and adolescents are increasingly overweight and obese, putting these age groups at risk of health problems, including NCDs. While these concerns have been at crisis levels for many years, COVID-19 has brought NCDs into a new focus. We are now very familiar with the fact that within this pandemic, people with underlying health conditions, including NCDs, have a higher risk of severe COVID-19 disease and more likely to die from COVID-19. Unhealthy eating is one of the main modifiable risk factors for non-communicable diseases. The excessive intake of the critical nutrients of public health concern, that is sugars, total fats, saturated fats, trans fats, and sodium, has been driven largely by the increase in the availability, affordability, and promotion of processed and ultra-processed food products. It is for these reasons that the Pan American Health Organization, PAHO, recommends the use of laws and regulations to reduce the demand for and the offer of products that contain excessive amounts of these critical nutrients. And one of the key policy tools to regulate such products is the use of front-of-package labeling to indicate to consumers which products contain excessive amounts of one or more of the critical nutrients. PAHO's evidence reveals that front-of-package warning labels are a simple, practical, and effective tool to inform the public about products that can harm health and help guide purchasing decisions. The nutrient profile model developed by PAHO allows the identification of products which should contain warnings on the front of their containers for the excessive content of critical nutrients that can affect health. Research carried out here in Jamaica yielded evidence that the octagonal warning symbol on food packages is the most helpful for consumers to correctly identify the least harmful products, correctly identify when a product had excessive amounts of sodium, sugar, and saturated fats, and increase their intention to purchase the least harmful product or none at all. With this in mind, PAHO is urging support for the proposal by the CARICOM Regional Organization for Standards and Quality, CROSSQ, for the inclusion of octagonal warning symbols on food products to help people make healthier dietary choices. Front-of-package labeling is not expected to have a negative impact on the economies of countries which implement it. On the contrary, it creates opportunities for the development and expansion of businesses which offer foods recommended as a part of a healthy diet, as consumer behavior drives product change. Front-of-package labels provide an important opportunity for us to take achievable, meaningful, and practical leap forward in Jamaica's non-communicable disease pandemic. The evidence is in hand that this will make a real difference in people's purchasing behaviors and therefore in people's health. PAHO is pleased to join with the Heart Foundation of Jamaica and other partners in this campaign to protect our children's health.
The Medical Association of Jamaica acknowledges the crisis our country and the world are grappling with in the form of chronic non-communicable diseases. These, including heart disease, stroke, cancer, diabetes, and chronic lung disease, are collectively responsible for almost 70% of all deaths worldwide, almost 3/4 of all NCD deaths, and 82% of the 16 million people who died prematurely or before reaching age 70 years of age occur in low and middle income countries like Jamaica. These illnesses loom as a pervasive threat to wellness at individual, family, and community levels, and our healthcare capacity is at risk of being outstripped. The cost to the country of handling this existential crisis is growing at an unsustainable pace, and we must act urgently if our vision of making Jamaica a preferred place to live, work, do business, and raise a family by 2030 is to become real. We therefore join with all conscientious stakeholders in supporting and participating in the Heart Foundation of Jamaica's front-of-package labeling campaign, Protect Our Children's Health. This strategy has been demonstrated to be an effective way to help control unhealthy dietary choices which lead to NCDs. The WHO states that taking these steps can not only save lives, but also provide a huge economic boost for our country. The MAJ believes in the power of information and choice, and supports putting this power into the hands of all Jamaicans. We urge everyone to make healthier nutritional choices and help rescue our country from the scourge of NCDs which threaten our progress and our prosperity. Let us start by protecting our children's health.
Thank you very much, Mrs. Chen. Thank you very much, Mr. Steen. And thank you very much, Dr. James. Now, before we move on to the next item on our agenda, I'd just like to ask the media representatives on the call to please note their affiliations so that we can know who you are, where you're coming from. Okay, with that said, let's now move to the next item on the agenda. I'm particularly pleased to introduce right now Mrs. Kay Morris Cook, who is the Communications Officer of the Global Health Advocacy Project of the Heart Foundation of Jamaica. And she will be, I think, giving us one of the highlights of this morning's proceedings, which is the campaign overview for the Protect Our Children's Health Media campaign. Mrs. Morris Cook.
Thank you, Dr. Marshall, and good morning and welcome everyone to the launch of the Protect Our Children's Health Mass Media campaign. The Protect Our Children's Health campaign intends to build on the success of the first 3 front of package warning labels campaign phases in Jamaica. It aims to encourage the public support and call for the octagonal warning labels on the front of packages, particularly those that are high in sodium, sugar, saturated and trans fats as a CARICOM standard to effectively help consumers make healthy food choices. The campaign also intends to continue highlighting the health harms of unhealthy foods like ultra-processed packaged foods that can increase the risk of obesity, type 2 diabetes, heart disease, and some cancers. The primary campaign video highlights the importance of an effective food policy environment that supports healthy nutrition for children by implementing octagonal warning labels on food packages that can enable parents to make healthy food choices for their children. Our message consistently reaches between 78 to 84% of our target population over the last 3 successful phases of our campaign. Recently research conducted by PAHO, the Ministry of Health and Wellness and UTEC, showed that the chances of correctly identifying when a product is high in critical nutrients, that is sodium, sugar, saturated fats, are higher when the octagonal warning labels are applied. Post-campaign evaluation data from 2019 shows that almost 55% of the respondents agreed or strongly agreed that it takes too much time to interpret the nutrition facts panel. And 92% of Jamaicans strongly support front of pack warning labels on food and drinks as part of government's plan to promote a healthier diet in Jamaica. And 82% of Jamaicans strongly agree on the policy requiring clear warning labels on the front of food and beverage packages and warn consumers when products are high in sugar, salt, or fats as a way of reducing obesity in Jamaica. And 87% strongly agree to support government's effort to increase children's access to healthy food and drink. Key messages for this phase of our campaign are: protect our children's health, give us octagonal warning labels on packaged foods. So foods high in sodium, fats, and sugar increases the risk of obesity, type 2 diabetes, heart disease, and some types of cancer. Finally, we would like to thank our co-branders, PAHO, UNICEF, CARE, DAJ, JAPINAD, and the PAJ for co-branding on this phase of our campaign. And now it is my pleasure to introduce you to our new campaign video.
We try to send our children to school with a healthy lunch, right? If we knew what was in some of those foods that are high in sugar, saturated fats, and sodium, would we still give it to them? An unhealthy diet as a child can lead to obesity, type 2 diabetes, heart disease, and even cancer as they get older. Octagonal warning labels on the front of food packages are 9 times more effective at identifying unhealthy foods. Give us octagonal warning labels on packaged foods. Protect our children's health. A message from the Heart Foundation of Jamaica and partners. We try to send our children to school with a healthy lunch, right? If we knew what was in some of those foods that are high in sugar, saturated fats, and sodium, would we still give it to them? An unhealthy diet as a child can lead to obesity, type 2 diabetes, heart disease, and even cancer as they get older. Octagonal warning labels on the front of food packages are 9 times more effective at identifying unhealthy foods. Give us octagonal warning labels on packaged foods. Protect our children's health. A message from the Heart Foundation of Jamaica and partners. We try to send our children to school with a healthy lunch, right? If we knew what was in some of those foods that are high in sugar, saturated fats, and sodium, would we still give it to them? An unhealthy diet as a child can lead to obesity, type 2 diabetes, heart disease, and even cancer as they get older. Octagonal warning labels on the front of food packages are 9 times more effective at identifying unhealthy foods. Give us octagonal warning labels on packaged foods. Protect our children's health. A message from the Heart Foundation of Jamaica and partners.
Campaign overview, and it was really fabulous to see that campaign advertisement, and we should be seeing a lot more of that. Please pay attention because the message is extremely important. Okay, we go from one highlight to another. So I'm now going to introduce to you the next item on the agenda, and that is a set of greetings that's going to be provided by Dr. the Honorable Christopher Tufton, MP, Minister of Health and Wellness for Jamaica. Dr. Tufton.
Ladies and gentlemen all, good day. My commendations to the Heart Foundation of Jamaica on their continued stellar efforts to raise awareness about the health harms of unhealthy foods and to encourage support for front-of-package warning labels as one way to enable consumers to make healthier choices. As the Heart Foundation undertakes its 4th phase of its campaign efforts in this regard, and under the theme Protect Our Children's Health, I wish them every success. The Heart Foundation's success will also be the success of the Ministry of Health and Wellness, which is prioritizing the achievement of wellness and adopting a primordial prevention approach to do so. The goal is to win the war against non-communicable diseases, NCDs, and improve health outcomes for all Jamaicans, young and old. An essential element of that effort is to give people the knowledge they require in order to make informed, healthier choices. Front-of-package labels help to satisfy this requirement, providing information on what pre-packaged products contain, and in particular, those nutrients that are of public health concern: salt, sugars, and fats. This, in turn, gives us and our children the power to make the best decisions about what we consume. This has never been more important to pursue than at this time, faced as we are with an epidemic of lifestyle diseases that affect or otherwise present a serious risk to the population. 1 in 3 Jamaicans lives with hypertension, 1 in 8 with diabetes. Only 4 out of 10 are aware of their condition. Further, 1 in 2 Jamaicans is overweight or obese. This is fueled by the increased consumption of sugar-sweetened beverages, but also limited fruit and water intake and low levels of physical activity. Our children are vulnerable. There has, for example, been a significant rise in the obesity levels among young people 0 to 12 years. In 2017, some 24% of students were overweight and 9% were obese, with 20% spending more than 8 hours per day sitting, 68% drinking carbonated drinks 1 or more times per day, while more than half ate fast food on 1 or more days per week. This data is not unique to Jamaica. The picture is similar elsewhere in the Caribbean, making it a plus that this campaign is also being rolled out in Barbados. Lifestyle diseases also take up a significant portion of the health budget and is a challenge to economic development. Jamaica spends some 15% of the health budget on diabetes, cardiovascular disease, chronic respiratory disease, and cancer, as reflected in the 2017 investment case for the prevention and control of NCDs in the country. That report also revealed that at a minimum, the Jamaican economy stands to lose some $77.1 billion over a 15-year period, that is 2017 to 2032, should we fail to implement a package of interventions for NCDs. We must rein in NCDs. This campaign should aid our efforts in this regard. The ministry and indeed the government of Jamaica have and continue to take steps towards this end. We continue to reset our policies and laws to create a more health and wellness conscious citizen. The discussions around the consumer's right to know what is in their foods, including this campaign, will continue this year with stepped up advocacy around finding a simple and consistent way to read labels and know the amount of salts, sugars, and fats in our foods. Last year, Cabinet took a decision to support front of package labeling. This is a step in the right direction. This year, we must decide on what this means and how it will be implemented. This campaign should help with that too. We must give consumers, including our young consumers, a fair chance of making informed choices about the foods they eat. It is unacceptable to do otherwise. Once again, my commendations to the Heart Foundation for their continued efforts in the public health interest. I wish this campaign every success. Thank you.
This is an extremely important campaign. I think everybody needs to pay attention and to provide their support as much as they possibly can. Now, before we move on, I just want to ask again our media friends, our media representatives, to please note the name of their media affiliation besides their name so that we know who you are and where you're coming from. So please, if you could do that, we'd really appreciate it. Okay, let's move to the next item on our agenda. And it's again a great pleasure for me now to introduce Mrs. Barbara McGaw, who's a project manager of Heart Foundation Jamaica Global Health Advocacy Project, and she will be introducing in turn our keynote speaker. So another great highlight. So Mrs. McGaw.
Good morning, everyone. I'm very pleased to be able to introduce our keynote speaker today, Ms. Mariko Kagoshima, representative of the UNICEF in Jamaica. She has served here since August 2018, and in this function, she's responsible for leadership, oversight, and guidance to the UNICEF Jamaica Country Office team and the representation of the organization within governments, donors, the civil society, and private sector partners. I know also she is a passionate advocate for children's health. Welcome, Ms. Kagoshima.
Good morning, colleagues, participants, and friends. Greetings to all of you on behalf of UNICEF country team in Jamaica. I wish to specially recognize Masters of Ceremonies, Dr. Kwesi Marshall, Chair of the National Food Industry Task Force, Dr. Honorable Christopher Tafton, Minister of Health and Wellness, Mr. Ian Stein, PAHO WHO representative to Jamaica, Bermuda, and the Cayman Islands, Dr. Brian James, President of the Medical Association of Jamaica, Mrs. Deborah Chen, Executive Director of the Heart Foundation of Jamaica, members of the media, and other distinguished colleagues. We are pleased to join the Heart Foundation of Jamaica and partners for the launch of this important and timely mass media campaign to advocate for front-of-package warning labels in Jamaica. Child food obesity is a growing health crisis. More than 30 years ago, the United Nations Convention on the Right of the Child established that children should be guaranteed nutritious, sufficient, accessible, and safe food, as well as the right to health and information. In Jamaica today, the need to protect, promote, and support childhood nutrition has never been greater. Childhood overweight and obesity from infancy through adolescent years is a growing health crisis. Approximately 9% of Jamaican children under 5 are overweight. The 2017 Global School-Based Student Health Survey showed the extent of this crisis. Since 2010, obesity rates have doubled among adolescent boys and increased by almost 50% in adolescent girls aged 13 to 17. Research in Jamaica tracking body mass of children demonstrated that children's obesity rate increased by 171% in just 4 years from age 7 to age 11. Childhood obesity can have lifelong health consequences, including increased risk of early onset of non-communicable diseases such as heart disease, high blood pressure, diabetes. Mental health impacts such as depression, social isolation, low self-esteem, and poor educational attainment. Children and adults living with overweight, obesity, and NCDs are more susceptible to infectious diseases, as we have seen during the COVID-19 pandemic. According to the Ministry of Health and Wellness, the lifetime cost of treatment and care of adults suffering from NCDs due to childhood obesity can have a devastating impact on the Jamaican economy and families. Our current food environment promotes unhealthy eating. Unhealthy diet of mainly ultra-processed food high in unhealthy fat, sugar, and sodium are a major contributor to the rise in childhood obesity and non-communicable diseases. In the Jamaica food environment, there is high exposure to ultra-processed food in homes, schools, and shopping spaces. Children and families continue to face barriers to making healthy food choices. Marketing of ultra-processed food to children is unregulated. These realities influence our children's diet, undermine their nutrition and health, and violate their fundamental rights. We know that children need healthy nutrition to grow, develop, and thrive. But how will parents and caregivers choose the healthiest food products for their families? How can children, adolescents, and young people make these choices for themselves? Research from several countries, including Jamaica, shows that octagonal-shaped front-of-package warning labels are the most effective at allowing consumers to quickly, correctly, and easily identify and choose healthier food. This type of label warns consumers if a product is high in sugar, sodium, fat, and saturated fat. It has been successfully implemented in several countries, including Chile, where mothers were able to understand the labels and children were able to tell their mothers not to purchase unhealthy products thanks to this warning label. UNICEF Jamaica prioritizes nutrition as a critical component of every child's rights to the highest attainable standard of health. UNICEF looks forward to a healthy food environment that protects and respects the children's right and makes it easier for families to choose healthier food to prevent childhood obesity. UNICEF supports implementation of evidence-based food and nutrition policies towards this goal. These include octagonal-shaped front-of-package warning labels and the finalized National School Nutrition Policy. Front-of-package warning labels make nutrition information more accessible and available to all consumers. These labels help children and families make healthier choices while shopping and in the home. These labels can also support the implementation of National School Nutrition Policy, as they can be used as a tool to identify and select healthier food for sale and consumption in and around schools. We must act quickly and decisively to implement octagonal frontal package warning labels to protect our children's health and address disturbing trends in overweight and obesity and resulting health consequences. Respect, protect, and fulfill the rights of Jamaican children to adequate nutrition and information. Let's help Jamaican children and their families make healthier food choices towards a healthy future. Thank you.
Thank you very much, Miss Kagoshima. I think what you have told us is something that we are very clear about here in Jamaica, which is the need to have appropriate nutritional strategies. From the package warning labels, first and foremost, but certainly there are others. So you've talked about school nutrition policy. You've also talked about ways in which we can improve our food and nutrition environment. So we can talk about product reformulation as well. So again, thank you, Ms. Kagoshima, and also thank you, Mrs. McGaw, for introducing her. Okay, now we're about to approach the finishing straight of this morning's proceedings. But before we do that, it's my great pleasure to introduce Ms. Rosanna Pike, Health Education Officer of the Global Health Advocacy Project of the Heart Foundation of Jamaica, who is going to give us our vote of thanks. Ms. Pike.
Thank you, Dr. Marshall. Mr. Ian Stein of the Pan American Health Organization, Ms. Mariko Kagoshima, UNICEF representative to Jamaica, Dr. the Honorable Minister Christopher Tufton, Dr. Brian James, Mrs. Deborah Chen, our Chairman, Dr. Kwesi Marshall, our most valued invited guests, ladies and gentlemen, a pleasant morning to you all. And glad am I to be here on this auspicious occasion on behalf of the Heart Foundation of Jamaica and the Global Health Advocacy Project's Food Policy Program, our stakeholders, partners, and well-wishers, to extend a very hearty vote of thanks to our speakers for being here with us today as we launch the next phase of our mass media campaign, Protect Our Children's Health, as we advocate for an effective food policy environment that supports healthy nutrition for children by implementing octagonal warning labels on food packages to enable parents to make healthier food choices for their children. First, we would like to extend our heartfelt gratitude and respect to our guest speaker, Ms. Mariko Kagoshima, for enlightening us with her commendable talk and encouraging us with her humble presence and good wishes. We would also like to place on record our deepest appreciation to Mr. Ian Stein. Your kind remarks will go a long way in encouraging us to persevere on our mission to create healthier generations. We also wish to recognize Dr. the Honorable Minister Christopher Tufton, who has honored us with his invaluable time to grace this occasion and his unfaltering support as we continue to coordinate our actions in combating the rise of NCDs in Jamaica. I would also like to take this opportunity to place on record our heartfelt thanks to Mrs. Deborah Chen and the Heart Foundation of Jamaica for their continued leadership in educating and advocating for policies geared towards the reduction of NCDs in Jamaica, as well as for providing information and screening opportunities to Jamaicans, enabling them to live and maintain healthy lifestyles. Dr. Brian James, I would like to express our sincere thanks to you and the Medical Association of Jamaica for providing your immense support and committed direction for creating a healthier Jamaica. Also, special gratitude to the Diabetes Association of Jamaica and to other organizations who co-branded with us in this effort. So PAHO, UNICEF, the Caribbean Institute of Health Research, the Medical Association of Jamaica, the Jamaica Association of Professionals in Nutrition and Dietetics, and the Pediatric Association of Jamaica. Your added voices will go a long way in getting our message out and understood by our people. To our chairman, Dr. Marshall, a big thank you for navigating the challenges of virtual communications by never missing a beat and ensuring everything flowed. You acquitted yourself most admirably, and thank you once again for a job well done. Ladies and gentlemen, an event like this cannot happen overnight. Though we started rolling months ago, it required planning and a bird's eye for details. We have been fortunate enough to be backed by a team of very motivated and dedicated colleagues, namely Ms. Donnell Christian, Patrick Champagne, Janet Morrison, Susan Fox, Michael Gonzalez, and last but not least, our own GHAP team. Their combined efforts bear fruit, otherwise it would have been impossible. To the team at Phase 3 and other members of the media who displayed evincing interest in covering this event, and all good hearts who worked behind the screen, I thank you. To the staff of the Spanish Port Hotel for the logistical support extended to us, we also thank you. Finally, I want to once again state that we're grateful to all speakers, not only for their words of support, but for their organization's backing of this campaign. We thank you, our virtual audience, for being with us this morning. It's been a great pleasure. And as we go, please remember to stay safe, walk good, and have a great rest of the day. Thank you.
Thank you very much, Ms. Pike, for rousing and forthright vote of thanks. I think you've covered everybody. Thanks very much. So we're just about to wrap up, but before I do that, I really do want to thank everybody that's been involved in the planning of this virtual launch. And I think the most important thing to be said is that this is a team effort. It's not just one person, it's several people all the way around. It's also something that I want to say, which is thanks to all of our attendees. So we're all busy, and I know that to spend some time with us has been a very, very important thing to do. So thank you very much. Now I'd like to ask the media representatives who are with us to just join us after this meeting for a chat, really, as well as to inform you further about what we are seeking to do. But I also want, before wrapping up, to ask everybody to watch out for this campaign and to provide their fullest support. This is something that's extraordinarily important. We're talking about the health of not only current generations of leaders, but future leaders, future champions in Jamaica. So we want to have the healthiest possible food and nutrition environment, and front of package, octagonal warning labels, and other strategies can be done so that we can reach that most important goal. So again, thank you everyone for your time. I also wish you a very safe and productive rest of the day, and we'll meet again sometime soon. Thank you.